Hello everyone. Today we will be studying the non-pharmacological advice for hypertension patients from the chapter Patient Counseling, subject Community Pharmacy and Management, presented by K.G. Saraf, lecturer, KK College of Pharmacy, Nasik. So, what measures or what non-pharmacological advice should be given to a hypertensive patients? First is to stop smoking. The first advice we can give is to first quit smoking and offer assistance if they required to quit smoking. Second, lose weight. Now the adult or normal weight or normal BMI range for adults is 25 kg per meter square, where they have given the waist circumference. The waist should be less than 102 centimeter for men and less than 88 centimeter for women. For non-hypertensive individuals, to prevent hypertension, they should maintain this BMI and their waist circumference. And for hypertensive patient, the average weight loss, if the hypertensive patient loses weight up to 5.1 kg, then he can reduce blood pressure up to 4.4 to 3.6 mm of Hg. So weight loss is a measure which can reduce BP in a hypertensive patient. Along with the antihypertensive medications, these non-pharmacological actions should also be followed. Next is review and advice on diet. Now, which foods to avoid? Avoid foods which are high in cholesterol or animal fat. Then encourage greater intake of fresh fruits and vegetables. Normal 300 to 400 gram per day of fruit and vegetables. Fish at least twice a week. Low fat dairy products, or you can try soya milk, which can lower the BP as compared to the skimmed cow's milk. Then use of dietary and soluble fibers in the diet. Use of whole grains and proteins mainly from the plant sources. It reduces saturated fat and cholesterol. And discourage excessive consumption of coffee and other caffeine rich products. So coffee should be avoided. And the main advice is or the main diet which should be avoided is usually the salt, which are very salty foods. Usually salt intake up to 9 and 12 gram per day is normal range in many countries, and it is shown that if you reduce the salt intake from about 5 gram per day, it will reduce the BP up to 1 to 2 mm of Hg. So systolic blood pressure will be reduced if you reduce the intake of salt from your diet. If you reduce about 5 gram per day, it will reduce 1 to 2 mm of Hg of your SBP. Reduce the amount of salt which are used in food preparations and avoid foods which have a high salt content. So this was regarding diet. Now regarding exercise, patients should be advised to participate in at least 30 minutes of moderate intensity dynamic aerobic exercise. So it is moderate intensity. You should not go for very heavy exercises or very fast, which will cause you heavy breathing. So walking, jogging, cycling or swimming, and that should be in a moderate speed. On 5 to 7 days per week should be done by the patient, and it should be done regularly. So this is a chart regarding which foods we can avoid for hypertension. Avoid salt, avoid ajinomoto, which is a major content in Chinese foods. Avoid baked foods such as biscuits, breads. Avoid baking powder, cakes, canned foods. Avoid dry fish. Avoid frozen peas, ketchup, papads. So these are all canned or which includes lot of preservatives. Then peanut butter should be avoided. Potato chips, preserved foods such as pickles, shellfish and sauce. So these are some of the foods which should be avoided in case of hypertension. Thank you.